I think the biggest and most important thing is being sensitive and having actually really listening, understanding, and then that would shape what the action should be. If I were to dismiss them as foolish or unsubstantiated, I've lost. I'm not really doing my job. So actively listening and taking those concerns seriously in order to be able to allay and reassure, allay the fears and reassure people really. And to do that, you needed to gain and build relationships, gain allyship. So go to areas, trusted areas such as community centres, places of worship, women's groups, where those communities are likely to be, and then build the allyship with the community leaders, community champions of that community, and create a space to have a conversation, um, and try and invite people. So even if it is a small group that attended, with their permission, I was able to record some of those conversations, televise them on the local media, and have them participate. It's working with people, with them, not without them, and say, well, tell us, because then others can learn. So I targeted South Asian communities where I knew that vaccine uptake were particularly low in some communities where there's obviously resistance and anxiety. So I made contact with the community centre leaders. I also gained a community counsellor, a council leader, and said, "You're a trusted person. Would you like to support me?" So one of them was perinatal mental health event. We knew that pregnant women were at greatest risk and that they were the ones that were not engaging. So I created this bespoke mental health event. I invited in the first one, there were many. First one was with older communities, women who were the influencers, the aunties, the mothers, mother-in-laws, because they were the go-to people for younger women. And then I listened to their concerns. I took with me a consultant obstetrician. I took a chief pharmacist who could talk about the constitution of the vaccines. I also took a respiratory physician, a professor. These are people with credible influences, and majority of those spoke the second language, Urdu and Punjabi. And we listened. We simply listened and answered honestly. With permission, we recorded it and we aired it in some of the Sky channels to amplify that message for people that felt less able to attend for various reasons, so we could take the message into people's homes. So that comes to mind. I know that I gained the trusted community champion of an Eastern European background so that I could understand how to engage with these Eastern European communities. And this particular lady attended one of our family clinics, one of the first in the UK, because it was important to take vaccines where places people felt less frightened. And I remember this lady bringing in a couple of more of her community with her, and then we asked would they mind sharing their journey, and because they were convinced, persuaded to have the vaccine, and we asked would they be a case study and go on our BBC Look North and just speak about their side. And there was a young dad whose partner had the vaccine because it was a newborn baby, and he spoke from the heart. He said, I had anxieties and concerns, but you, both myself and the community champion, convinced me to come so I can protect my baby. I want to reassure everyone else listening today, watching the channel, that it is safe. Come and talk to someone. They'll speak to you about any queries and questions you have. So there are some key things that will stay with me, but there's many examples like that.